Hello friends and colleagues, I'm Stanislav Chernog, the author and creator of the online skill Vector Massage and Somatics, and we finally decided to take on a hot topic. We decided to discuss the topic of health and the shape of the female breast. We will shoot two videos. The first one is devoted to the problems that arise with the health of the female breast, its mastopathy, it's a violation of the lymphatic outflow, and we will dedicate the second video to bringing the breast into a more beautiful visual form, to lift it to increase its density and structure. So subscribe to the channel not to miss the second video. So today in this video we will talk about the problems that arise with the health of the breast. It must be understood that mastopathy, problems with cysts in the chest, are extremely common. It must be understood that a huge number of women literally die due to the fact that something forms in their breasts, it degenerates into something bad, and women actually lose their breasts. The operation to remove the breast is quite common, and a fairly large number of people sadly die from breast cancer. And accordingly, the sooner you take care of breast health, the more you reduce the risks that something will happen to you that you don't want in your life. So let's see why problems with the mammary glands may occur. Cyst and mastopathy, tumors, why all this occurs. The fact is that the mammary gland is an area that usually has a rather low metabolism. Accordingly, blood circulation in the interior of the mammary gland is rather limited. Therefore, the main outflow of substances, decay products, occurs through the lymphatic system. The mammary gland takes lymph from itself and sends it to the axillary lymph nodes. If the axillary lymph nodes are clogged, then this leads to problems with the chest. The axillary lymph nodes send lymph to the venous angle. Accordingly, if you have problems in the venous angle, the main place where the lymphatic system flows into the bloodstream, then there may be problems in the chest. Accordingly, in order for the breast to feel good, it is necessary to ensure a normal outflow of fluid from the breast. First of all, we work with the venous angle, then with the axillary and lymph nodes. Then we work directly with the place where there was a seal, inflammation, or whatever it was. Here it is necessary to separate two situations. A situation that is connected with the fact that a person now has an acute process, and in the case of an acute process it is necessary to work primarily with the surrounding lymph nodes, and we act extremely delicately on the site of inflammation, pain, cysts. You can afford to do this simply by laying on your hand if you find yourself pushing through your chest, tightness and soreness, and at the same time you do not have any chronic process, then you can work with these places quite regularly and quite vigorously. First, it is necessary to work out all the surrounding lymphatic structures. After you have done this, you can put your finger on the enlarged or indurated area and begin to work on this place in next directions. Firstly, you exert tension towards the nipple, because in some cases a secret accumulates in the vesicles of the mammary glands, and if we direct this secret towards the nipple, then this secret will come out and thus the mammary gland will be cleaned. The second direction is exactly the opposite. We find these bubbles, these seals, and we begin to push in the direction of the armpit. How to distinguish between these two directions? How contradictory they are to each other? The fact is that when we work with the lymphatic system, we must first of all exert a superficial effect, very soft and smooth towards the axillary lymph nodes. This is the impact that we make past the inflamed, enlarged and indurated structure in the chest. When we work directly on the mammary gland in order to cleanse it of those fluids that have stagnated in the vesicles, then we act directly on the densified zone and exert slow and shearing effects. Our task is to find the place of compaction and, as it were, push this air bubble or volume of compacted liquid towards the nipple. Here, I recommend that you remember that this work should be carried out regularly, not quickly, and may require you to rehabilitate for about a month, and maybe even for 2 or 3. Be persistent and patient because it's worth it. Women suffer a lot from breast problems, for example during breastfeeding, and really this is the reason that disfigures and kills women. In addition, it is worth remembering that compaction, some inflammatory processes, can significantly change the shape of the breasts. One of the main reasons for the asymmetry of the mammary glands is inflammation, cyst formation, and tumor formation in the breast. Accordingly, when you work with the lymphatic outflow, at the moment when you work with the mammary glands, this will lead you to the fact that your breast will become more beautiful and more symmetrical. It must be understood that there is a difference between the breasts of a woman who has given birth and the breasts of a woman who has not. A question from the audience: for what reasons does mastopathy occur? Mastopathy occurs due to two reasons. First, the ducts of the mammary gland are clogged and the milk inside the mammary gland begins to become inflamed. This may also be the case if the woman is not breastfeeding. All the same, the mammary gland secretes a certain amount of secretion, and even if the woman has never fed, then the ducts of the mammary gland are clogged. The second reason is a violation of the outflow of lymph from the space of the mammary gland. We should remember that the mammary gland reacts extremely positively to touch. If a woman does massage movements herself, watch our next video dedicated to just this will have a positive effect on health and beauty. As kneading your chest by yourself at times is not very convenient and rather boring, do not prevent your partners from massaging you if they want to touch your breasts. This helps the breasts to recover. The fact is that the release of sex hormones also contributes to the fact that the breast comes in a better condition. It is also important to remember that the key point in terms of breast health is the circulation of lymph through the human lymphatic system. We can have quite healthy breasts, but if we have problems with the venous angle, then there will definitely be problems with the breasts. And Stanislav Chernog was with you as always, the author and creator of the online school Vector Massage and Somatics and the YouTube channel of the same name, where we talk about beauty, health, self-healing, and at the same time learn to make good money on it. Until we meet again, friends, goodbye.